Hey guys, Dr. Carver back again with another quick video for you. Now my last video was about spinal decompression and why it's a really effective treatment for things like disc herniations, sciatica, radiating pain or numbness, spinal stenosis, all those really stubborn conditions. Now because there aren't many clinics in our area with spinal decompression units, we tend to get a lot of questions from our patients when we do our consult. So I thought I'd make a short video and talk about the 5 most common questions we get asked about the treatment. So the first question we always hear is, how many visits does it take? Everyone wants to know how long it takes. And this all depends on your condition and your spine. We generally recommend a 20 to 30 treatment protocol. We'll treat you really frequently in the beginning and then taper you off. The whole process usually takes about a month to a month and a half. If your condition is really complex, we may need to add a few treatments, but typically 20 visits gets the job done for most people. The next question we hear a lot is, do I have to have an MRI or do I have to have an X-ray even? The answer is, at minimum, you'll need an X-ray of what your spine looks like currently. Why? Because this is a medical procedure and we take a lot of things into consideration when we develop our treatment plan. Also, there are a few conditions which would prohibit you from doing spinal decompression. So X-rays will show us where to treat and help us make sure you're a candidate and that it's safe. That's going to bring me to my next question we hear. If I have this condition or that condition, can I still do spinal decompression? So there are a few we watch out for. The first are infections or cancers of the spine. These are considered bone weakening disorders, so we don't do spinal decompression there. Pregnancy is another, and sometimes really severe osteoporosis is a red flag. A really big one is spinal surgery. If you've had a back surgery already, can you do decompression? The answer is, as long as there's no hardware implanted in the spine and it's been at least 6 months post-surgery, then typically spinal decompression could be a really effective option for you. But if you've had surgery and they put hardware in the area we're looking, then the answer is no. Another question we get a lot is, once I finish my treatments, do I need to keep coming back? The answer is no. The treatments are designed to restore disc height and the results are really long lasting. So typically once you're done, you're done. Now that doesn't mean that accidents won't happen. You can have slips and falls and re-injure yourself, or if it's a really old and chronic condition, flare-ups are a possibility no matter what you do. So occasionally a patient will come in after a month or two and say they'd like a tune-up treatment, and that's totally fine. It does happen. But they won't need to do the full protocol again unless it's a brand new condition or a different area that's developed a problem. The last question we hear a lot is, does my insurance cover it? Everyone wants to know if insurance will pay for it. And right now the answer is no. When billed properly and coded correctly, we've yet to see an insurance company pay for the treatment. If you ask your insurance company about it, they'll probably tell you it's an elective procedure or an experimental procedure. I hate that term experimental because it makes it sound like there isn't much research on it, and that's just not true. There's actually quite a lot that proves it's very effective. I'm going to leave you some links to a couple of my favorite research studies. One is from the Mayo Clinic, the other is a patient satisfaction study. At the end of the day, it's extremely effective and it's very affordable. We have several payment options and we've tried our best to make it accessible to anyone who needs it. So hopefully this helps out if you're curious about spinal decompression. If you've been told or you suspect you have a disc herniation, give us a call. This may be a really good option for you. As always, if you're liking our videos, give us a heart or a wow emoji and let us know you're out there. And feel free to share this with anyone who you think may need it. Have a great day. God bless.